I'm Bill Blatchford. I'm here at the 2016 Toronto American Academy of Cosmetic Dentistry. I happen to be privileged to be sitting here with Dr. John Kois of the Kois Center. John was the last speaker of the day. They purposely put John here, the last speaker, to hold the crowd for the last day. He certainly did it. I was in the room most of his lecture. Absolutely unbelievable. Nobody knows more about dentistry, in my opinion, restorative dentistry, than Dr. Kois. John, I'd like to ask you just a couple questions. You know my daughter, Christina. She's one of your students. You may not know it, but Carolyn and I gave her your first course as a graduation present.
Actually, I didn't know that.
Okay. We felt that once she graduated, she needed to learn how to do some dentistry. And so we sent her up to your program. And so she and I have made a decision to work with private practice owner dentist, because my opinion, and I'm prejudiced of course, and I'm somewhat old school, but I believe that patients get better care when they see the same dentist perhaps their whole life, and maybe a couple, 2, 3 generations of patients. What do you see happening in dentistry, and maybe some benefits of that and maybe some pitfalls of that?
Well, it's like anything else. I don't know if we could always make universal statements,
Yes.
right? Because sometimes practitioners that have been doing it for a long time aren't always providing the best care
That's
for
correct.
people. But in general, I get the sentiment, and I would say the one common denominator of all the dentists that come to the center is they care an enormous amount about their patients, and the pride that they have is second to none. In other words, I often say this: dentists say, I see my patients, they're my friends, I see them in the grocery store, I want to be proud of what I've done. And the commitment is second to none. Your point is well taken. There is a lot of pressure right now, business pressures, that are really creating struggles for sometimes the individual practitioners, which is why even as a center, we've tried to take some initiatives to help. We've created a buyers group. We're trying to make individual practitioners more competitive because they need to be. It's the way it is.
Well, the thing that I've seen is that there's a lot of pressure on low fee, because that's the selling feature of so many of the corporate offices, and lots of marketing to get people in pretty much at any cost, and get them in promising things that perhaps can't be delivered, and then not spending the time and the resources to train the dentist, because they have, I hate to say this, but and there are some good ones out there. I agree with you completely that you can't make a universal statement, but I see in so many of these offices they have what I call transient dentists that pass through.
Sure.
And because they're not earning much individually, they don't have the money themselves to take the courses, and it's all about corporate money and profit. And
yeah, I actually think the problem is slightly different. I mean, and I'm sure it was
that's
the
why
same.
I'm talking to you.
Yeah, I think the problem was surely the same for you. When I started in practice, my beginnings were very modest. My early years, I was in the Air Force, and I didn't have a significant income. And my first couple of years in practice, in fact, my first year, my adjusted gross income was 0. But there was hope. The future was still there.
Yes.
And so what I see that's different is not so much that in the early years people are struggling, because we always did that, the debt service, some of the other problems. But I think people are becoming a bit more pessimistic that it's not going to turn around. And so now the struggle is going to be longer, maybe more of a bigger problem, a bigger picture down the road. And so people are a little bit more, in general, pessimistic. But I also see the opposite. Many dentists in small towns are doing very well.
Yes.
They're really enjoying practice. They're enjoying access to the new technology. It's very strange where the pressure points are for many aspects of providing dental care today.
Years ago, and I don't know if you ever followed Avram King, and Avram King predicted the 2 tiers of dentistry eventually, and I think Avram King was right. I've taught that all along. There'd be a couple tiers. Do you see that developing more all the time as we have these corporate offices, and then we have the highly trained individual dentists like coming out of the Kois Center?
I definitely think there's a relationship between a skill level and outcome potential. And for instance, dentists are not really challenged by their success. They're really compensated by procedures,
Yes.
not how well they're performed, which is a very big problem.
Yes, it is.
That's one issue. And what I think is happening is it's more difficult for the really good dentists to be more visible to their patients, because it's very easy through social media and many other ways to market practices which may not be as much on merit as they are on exposure, and it's just harder.
I think that's one of the things that we've got to do, and I think we can work on this, is we have to work with these dentists. For example, I worked with a dentist today who is a very smart man, and yet he is getting virtually no word-of-mouth referrals, which I said, we got a problem. I actually asked him, what are you doing to keep people away? You're doing really fine dentistry, but he's getting virtually no word-of-mouth referrals, and all of his referrals are coming from Google, which is just what you said. I mean, anybody today, and this is good and bad, and I see more, anybody can get a good Google review. You're very highly selective on who you ask for the review.
Right.
You get nothing but wonderful 4 or 5-star reviews, and he's getting those when he asks for those, but his word of mouth needs help. And that's where people that appreciate the quality, I think, need to be more, that's where he needs to be more visible. And I think that's something that we've got to work on, is
Well, it's true. I do think dentists also have to spend a little more time making sure their patients appreciate what they're getting and what they're doing, because I constantly get feedback from dentists that many times a patient may have left the practice but then winds up coming back once they really realize what the differences are.
Well, and part of that is that the difference, and I know you call it mediocrity, there's no joy in mediocrity. And it's a little bit of a sad thing, is that most of the times patients don't know the difference. Patients, they can't really tell that difference for a while, but eventually the difference shows.
It shows.
The difference shows. And I think the dentists have to get better at communicating what we're doing that's different than some of the other dentists. I mean, here's this, I don't want to mention the doctor's name today, of course, but my gosh, he does everything under a microscope. Well, right there, changes the whole level.
No, it's really important, because I want to see nothing more than those types of dentists that are so dedicated to helping their patients, to doing the right thing. They're the ones that should be the most successful. And there's no doubt about it.
And so many of these doctors are, I find, to be excellent clinicians and really poor communicators. They're just not communicating to the patient the difference in the treatment, and they're not putting the effort into that. They're spending their time.
Yeah, and I think that the other problem, obviously just because you use a microscope isn't enough.
Well, that's right.
Right.
I know that.
But the point is, people do need to understand better, efficient protocols, and to be able to do high quality care, but to do it efficiently. Otherwise, it is getting very difficult to make a living.
Yes.
And to be very competitive.
Yes, and that's one of the things I see too, is the efficiency. Is we've got to work on that, because especially if they're trying to compete in this marketplace where they have to keep their fees moderate. They can't raise their fees really high, and they want to turn out the high quality. They have to become pretty efficient at doing that and still maintain the quality. And that seems to be an issue, and that's a paradigm I try to work with, is that they've got this paradigm that to work more efficiently, quality has to suffer, and I've never bought into that. I give them the example, as you know, I've been a pilot for 45 years, and I talked to him about when I first learned to fly. I was landing a Cessna 150, which came in at 60 miles an hour, and the first time the instructor handed me the airplane, the ground is just rushing up at me, and I can't decide what to do. And before I quit flying, I was coming in at 160 miles an hour, and it seemed like the plane was just floating down. And then I said, now, what about the F-18 pilot slamming it down an aircraft carrier? I must be a worse pilot because I land slower. No, he's just better.
Yeah, yeah. Well, you know, I feel like we should live in a world where dentists are compensated based on successful outcome,
Yes.
not just procedures.
How do we change that?
Well, we're trying,
Okay.
but it's not easy.
Yeah.
There are big machines out there.
Yeah. No, I would certainly agree with you. You know, I had my full mouth restored 18 years ago by a friend of ours in Seattle, and gosh, I mean, all done in feldspathic porcelain, and in 18 years I've had virtually no problems. Now, I don't wear a night guard, I chew ice, I'm a terrible patient from that point of view. I do everything that I'm not supposed to do, and yet we've had virtually no problems with that, and he was compensated for that, but probably not enough. Probably not enough. Well, you do a great job with our clients, and I want to just thank you for what you do for dentistry.
Oh, you're welcome, and I've heard the same from, you know, it's funny how when you resonate with someone and we get to really work on these aspects, we come at them from both sides, and I think it's all a win-win.
Yeah, well, very good. Well, thank you so much, John, and again, just thank you for what you do.
Thanks.
Thank you.